So, hi, my name is Karen, and I'm one of 3 co-founders of Motognosis UG. We are using medical devices, we are using gaming devices for medicine. So, in my PhD, I started using Microsoft Kinect, which is like a camera, a fancy 3D camera that provides the 3D images. And I just try to use it for gait analysis. So how are people walking? Can we use it? And 3 years ago, we took this idea and made a small startup company. And we are doing medical studies with these devices since. And I'm mostly a software developer, but I also do lots of medical data science and statistics and signal processing. And in my spare time, I'm doing this for my PhD in medical computers or medical science. I'm one of our. Before I was a PhD student at Charité, I had a guest researcher account, and we do a lot of studies with multiple sclerosis patients and Parkinson patients. And these are neurodegenerative disease, and these people show a lot of motor symptoms, so like tremors, like imbalance, they fall a lot. And well, basically I use the Kinect to somehow detect these signs and try to help to use the doctors these kind of technology. So from my point of view, IoT and the connected world is rather about data. And in medicine, we have a lot of these small ecosystems. And with the possibility of new technology and the connections of these new technologies, we can do a lot. But to give you an understanding of this impact, I will give you a really small introduction to a lot of medical projects. These things are currently happening. These things are some research, but this is like real. It's not fictive. It's happening now. A lot of these projects are not my own, but I find them quite interesting. And also some of them are a bit creepy, so just be prepared. New technology and also new developments affect us in medicine in different ways. Like we have these that affect us right now, like implants, like new diagnostics, like all the things that's directly in our body or attached to our body, but there is even more. Like in hospitals, you have these huge IT, which basically make the hospital run. So without any technological developments and IT in medicine, we wouldn't be at this point right now, and it's a huge influence. But let's start with some basics. Like one of the most common implants are cochlear implants. So if a baby is born deaf and cannot hear anything, it would be benefit from this kind of implant. It is like an advanced hearing aid. So you have this out part, which is basically hearing aid, basically like a microphone, and you have this implant part where this little device is put between the skull and the skin. So it's under the skin and connected to this microphone part. And then a small wire gets into the cochlea. And from these, so the signals, the noise, are transmitted into the inner part of the ear. And then everything goes normal. It's just like a benefit if some in the middle from the outer ear to the inner ear is kind of crushed or not working properly. So this is rather easy. If we want to look at the eye, it's a bit more complex. In the late 70s, there were the first trials to bring back eye vision to blind people. Here, they had to go the right way, the direct way into the visual cortex. So you see here, there are electrodes going directly into the brain. And this was in the early 70s. So they had these 5-kilogram computers and a huge pair of electrodes. And the results back then was that these people at least could differentiate between black and white and some strong contrasts. There is still some development in this field, but it's they currently focus on not that impact surgery and more like visual aids who analyze the scene that a person is looking at and then give some audio feedback to them. But the eye can also be used for other things like diagnostics. So Google and Novartis are currently developing a smart contact lens that is measuring the blood sugar or glucose level for diabetics. So these small contact lenses could give the diabetic person like an alarm if his blood sugar level drops too low, because these people tend to fall into a coma and they don't recognize it by any body symptoms. So this would be quite interesting. To get a bit more complex, I've mentioned I work a lot with Parkinson patients. So Parkinson patients, you see, this patient has a really large tremor. And since the 90s, there is this thing called deep brain stimulation. It is an implant similar to a pacemaker. If this is not properly working or is off, then the symptoms is like this. If it's on, it's like this. So how this works is they're putting electrodes deep into the brain, and these electrodes stimulate a specific cell type, which then produces the missing hormones for these patients. It's really similar to a pacemaker. And these electrodes are connected to these wires. And then you have also, similar to a pacemaker, these control units. And the patient on the doctor have the little remote control, so they can switch between different programs and put these electrodes on and off. But there are other things like brain-computer interaction is a real interesting thing right now in medical research. As you can see here, the patient is really spastic, so she can't move at all. And she had this kind of implant right over her motor cortex. So what she's now doing is she thinks about moving her hand, and the robotic hand responds. So she is now capable to control a robot hand so that she could drink something. And this is currently more in research. It's published in Nature, but there is some really great developments on that. But to go a bit more into the things that maybe affect you more, there are technology like virtual realities. And I just want to show you how virtual reality devices are used for therapy. There's this project called Walk Again. The idea was that paraplegic people, so people who could not walk anymore, who are wheelchair bound, use these brain-computer interface to control an exoskeleton and learn to walk again. These people had a really tough and widespread training session and training plan with the exoskeleton and also with virtual reality devices. And they just showed these persons that how it would look like to walk again. And they just should imagine to walk again. And what happened was really, really unexpected because, in short, people started to feel their legs again, to feel touches at their legs again, and some of these people also started to move their legs again. So there was this real interesting, huge recovery that no one expected before. And there are different theories how this happened. One is that due to the combined stimuli from virtual reality and from this training, some parts of the brain recovered and also some remaining nerves in the spine got reactivated and helped to make the missing connections from the legs to the brain and vice versa. But there are also other really, really interesting virtual reality approach for therapy. For example, Samsung Be Fearless is an interesting program where they tackle anxiety and phobias with virtual reality. This is interesting because with virtual reality scenes, you have these really controlled and safe environments for people. So you don't have to get any physical thing there to tackle your fear of heights or your anxiety of speaking in front of people. You have this controlled environment, which is working rather well so far. And also there is some things of pain therapy. So some specific types of pain do not respond to normal painkillers. So these patients are in constant pain and nothing really helps. So there was a study who just showed these patients happy virtual reality scenes. And this is an fMRI scan which shows brain activity. So all these yellow areas you see is the patient is in pain, he suffers. And when these virtual reality thing or scene is put on, then endorphins get invoked by the patients themselves, and this reduces in pain. So maybe you know, if you're happy, you don't feel that much pain. And this is what virtual reality and this study used to lower the pain for these patients. There are also not only therapy, but also diagnostics advantages. And here I'm talking a bit about my research and what we are doing. We use the Kinect. The Kinect is originally a gaming device for the Xbox, and it emits these three-dimensional point cloud. What we did is, in one of our studies, just put it in a sleep laboratory above of a patient. And our question was, can we detect breathing signals? Can we detect apnoe, which is a lack of breathing? So the patient just stops breathing for several minutes, and it's really not healthy at all. Typically this is done by putting a lot of cables and sensors attached to the person. It's really uncomfortable. You have to go to this sleep laboratory. And what you are seeing right on the right is that we get some decent just breathing patterns and also detected these mentioned apnoe. So the technology itself could be used for like home monitoring of apnoe patients. But the real benefit of the Kinect is that it provides like these 3D images. It recognizes a person, and also it's put these anatomic landmarks, so like the skeleton you see on the right. And you can use this for tracking the patients for different movement tasks. So, for example, Parkinson and MS patients, if they go to the doctor, they have to perform specific tasks. So the doctor sees how much is he or she swaying, is she falling, has she some spastics and some lags. And one of our approaches is to just record these motions and then calculate specific parameters that could then be interpreted. Because currently it is, the doctor is looking at this patient and just says, okay, he is swaying between 0 and 1, and he just has a scale from 0 to 3. And this is extremely subjective. It is not really reproducible because it's highly influenced on the doctor, but also in which state the patient currently is. So we are exploring this a bit more, but it could be they could be done extremely more with just these movement analysis. For example, there was this publication, and they just had a look at the behavior of children and wanted to have a look if they could detect autism in children, because these people also show some specific movement problems, and but also they try to behave different in a room full of playthings and toys. And they published this with some extent of success. So this was a lot of medicine, a lot of different projects, just in short. In general, currently the approach in medicine is that it's getting more patient-centered. So typically it is the patient comes once or twice a year to the doctor. The doctor really relies on what the patient is telling him. It is for most of the patients quite tricky. How often did you fall? When is it better or worse in the morning, your symptoms? How was it last week? How was it 2 months ago? It is often not that easy for the patients, but also for the doctors. So in research, they try to explore the use of wearable sensors or motion trackers, like fitness trackers, just to get more knowledge about the patient, but also on the disease. And changes in their behavior could be used for medication adjustment, and so on and so on. This is the data of one patient of one of our studies, so an example on what the doctor would get from these devices. And it's quite interesting, but also highly private data, because as you see here, the patient tends to take a nap on the weekend for 1 hour. So is it something that you would tell your doctor? Is it something that you think is important? Just think about this. And the developments are getting even further. There are wearables developed that can monitor your eating, drinking, and even social behavior. This is really interesting because it could be used to detect things like depression or anxiety or changes in like your motor symptoms. But it's highly private data. We have to make a cut between, okay, we have this really private data, and currently it's used only for research. And before every medical study, there's this ethic community that have to decide if this is okay to do for the doctors and for the patients. But there's also a lot of interest in the industry to do medical things. One of the biggest players, Apple, it has his research kit where researchers can use an iPhone or Apple device just to collect all the data and put it in this research kit for their own studies, so for the research studies. But for example, Fitbit is a typical fitness tracker, but it tries to advance into medical and healthcare, but also like diagnostic purposes. So it's basically want to use all your data for medicine. Another interesting fact is that a lot of tech companies cooperate with pharma companies. So, for example, Pfizer and IBM using IBM Watson for drug discovery and is quite successful with that. I already showed you Novartis and Google with their smart contact lens. There was also another project from Microsoft and Novartis, who were using the Kinect also for medical scaling. So what the doctor did before, just by looking at the patient, the system could do by themselves in a machine learning approach. Unfortunately, Microsoft just killed the Kinect. It was one of the most promising devices for healthcare, but it didn't perform in its primary market, which is kind of an interesting decision. We think, or most of the people think, that they just focus on the HoloLens, the development of the HoloLens. But nonetheless, a really promising device for medical research, for other research, for medical usage, just died. But there are more promising news as well. Who of you have seen Star Trek, at least something? Yeah, so they have these medical tricorders. Just make a scan and the doctor sees every disease, every health condition that a patient has. And there was a huge thing by Qualcomm, who was looking for the startups or the solutions that get most near to these medical tricorders. And in mid of this year, we have 2 winners. So there are these prototypes who can measure more than 13 different medical conditions, and they are now working on to use this and make a real product of it. So we'll see when we have the first tricorder that can measure nearly anything without touching everything. Another thing that is just really big currently in health startups are chatbots that uses your response and try to make medical decisions to help you, but also to help the doctor. And Ada Health and Babylon Health are just received 46 and 60 million just to do more of their development. So this is kind of huge and kind of interesting because it really shows how startups are pushed to do a medical revolution in some kind. And another really well-known startup is 23andMe. This gives gene sequencing. So you just have to take a sample of your salvia and then send it in, and they make a complete gene sequencing. And if you want, you can get the information about health risks and disease that maybe tackle you. There is, this brave new world. So technology influences us in medicine to an extreme demand from the industry, from a startup point of view, and also in medical research. But we face some challenges with it. And I want to speak about that a bit. I've shown you the possibilities of virtual reality before, and there was this really great talk from Michael Lehr that I really recommend you if you're doing something with virtual reality, because she explained how to develop applications so your customers don't get anxiety attacks, don't get panic attacks, don't get motion sick. It's really important that you know how to develop applications for this, because it is so immersed to the person that all the benefits I've shown you can be complete reverse and can be used for the negative, like triggering anxiety attacks, like triggering dizziness and really medical problems if you don't do what you're doing right. And how is it currently in hospitals? So I mentioned briefly at the start of this talk, the company runs on really different software. So one of the backbones of each hospital is like the hospital information system. This is like the nervous system of this whole institution. Everything is connected to this, and everything is attached, and everything have to be responsive to this system. And the current development standards on this, maybe you have a guess, like these, is there agile development in health systems? Nope. So these systems are built over a couple of years by waterfall system. They have a lot of legacy code. They are old languages. No, also the developers tend to be older. I know of companies who are developing these systems where their average developer age is about 50, which is huge, so immense. Also, unit testing, integration testing. Well, they have a Q&A team, but real unit testing is mostly not done. It is quite interesting that these huge systems don't fail more often. And if they do, it makes quite a round. Last year in Australia, there was a huge hospital who was often shut down for several hours because their system didn't work. They just deployed a new version of their hospital information system, and it had so many bugs in it that it didn't run properly, and they have to switch back to writing everything down. And this is, yeah, that really sucks. Also, what do you think about current security standards in these systems? In everything. It's not just the hospital system, also the pacemakers, the deep brain stimulations. Last year, the FDA just recalled 500,000 pacemakers because a hacking team just announced that they could simply switch these pacemakers off. And the people were quite scared. The interesting thing is the FDA didn't recall them because of these failures. They recalled them because the people were afraid. So these systems most often are just safe and secure because you have to be physical near them, and it's quite a niche. So it's not that interesting for hackers so far to hack these devices. But just imagine if a Parkinson patient is a victim of one of these attacks and he is driving. A pacemaker, most of the receivers of the pacemaker will still live for some degree because they are not that dependent. But if you start having these tremors and you're just driving a car, that's not that good. Another market is the mobile health market. So there are over 300,000 medical apps or health apps. A good amount of them are free, and most of them don't have an FDA approval or a medical certification. So they just claim by themselves they help you with your drug management or with tracking some of your symptoms or like a patient diary. And they didn't get approved at all for these things because they are not directly medicine. And there were quite a huge number of studies who just had to look at the privacy policy and also on the direct security of these apps. And it was quite often shown that most of the free apps just sell your data to advertisement companies, to map companies, and they also gather more data than they should. So we heard the word Datensparsamkeit already here in this track this morning, and most of the apps don't apply to that. So they gather a lot of data, and it is often quite unknown what they do with this. But there are also problems in the science field. So in some countries, there is this phenomena. If you ask a friend about his meaning or his opinion about something, you get always a positive feedback, because people are afraid to, no, this is just not a good idea, you should maybe do something else. This is a bit called the publication bias, and this also applies to scientific papers. So most of the papers that are shown and published are papers that show some promising results, huge effects. It's the new big thing. And unfortunately, a lot of papers who show the opposite or reject some findings before, or just show, okay, there is no correlation, there is no relation between something A and something B. This is not getting published. And this leads to the problem that sometimes false information is spread, but also that sometimes more studies have to be performed than are originally necessary. Another problem in research, but also in developments, is this study, this little paper, had a look at different implementations of deep neural networks. I guess nearly everyone heard about deep neural networks so far. It's like the new big thing in image recognition. And they just show that most of the deployed networks are really valuable if just one pixel or a few pixels are changed. The network didn't work at all anymore. There are mechanisms to prevent that, but they were not implemented in these models. So now just imagine one of these models are used for tumor detection in MRI figures. Or one of these is used for like medical scoring or decision making, or it says, okay, you have a headache, you have some vision impairments, it decides somehow that it's not a migraine, it's a tumor. So what are you doing now? You as a person who get this information is kind of confused, kind of irritated. Your doctor cannot really relate to the decision that was made. He was not sure. And what consequences had this for us? Another really great study is about the Thamia thing. It was honored by an IG Nobel Prize. An IG Nobel Prize is the Nobel Prize for studies and papers who first make you laugh and then make you think. So if you want to read something really interesting, just go on the IG and see what was honored with an IG Nobel Prize. And this study just had a look at what happens if you skip a minor statistics part in fMRI images. And what they found is, if you skip this step, you find brain activity in dead fish. So they put these salmon in an fMRI scanner and performed their typical studies. They just want to have a ground truth if the system is working, and it performed quite well. And then they just played around a bit with some functions of the fMRI technology and software, and they skipped these multi-comparison step. And what happened is that they got false negative results. The problem is that most of the published fMRI studies didn't mention if they did this step or not. So every study that didn't clearly say, we have done this, we have checked for this, may be a false positive result. And this impacts hundreds and nearly thousands of papers since the release of these fMRI scanners. So we have also, besides from the technology, besides from bugs, besides from error, besides from we didn't know any better, sorry, we as developers and also we as researchers have an ethical and moral thing. So we have to make a clear decision. We have responsibility. We have to be aware that if we do something in medicine, or maybe also in gaming, we have to make sure that we don't harm people. And also, I think most of you are well aware of these data at the new oil site by Clive Humby. The site contains more. He also explains why he thinks this is quite fitting. And I agree with him to some extent. But I would also like to add, in medicine or everything, when you gather your data, just make sure you don't burn everything. So, thank you. Questions?
You showed a number of health apps, available health apps
Yeah.
in the various app stores. What do you think about regulations versus availability? Like,
this is a broad question.
Yeah.
So we have to see on. So we have to differentiate between different types of regulation. I think it is quite tricky to regulate all and everything. That does not work. But if an app gathers data about a patient or about a user, then I think this should be regulated to some degree, and it shouldn't just be, okay, put it in your private policies and then everything is fine. But I think this is currently in the current system not applicable. So still things to do.
a lot to do.
Yeah.
There's a question here from someone talking about or suggesting if sleep monitoring application could replace pressure pads for monitoring sleeping children.
Okay, it depends on what you want to look at. I think these pressure pads that you put under children when they are sleeping, they detect not real symptoms, but just if the child is still moving. So for an alarming system, these type of data would be totally fine. And I think to some degree you would also be able to get breathing patterns and some movement patterns. I think it would be sufficient enough. You could use also these 3D depth data and detect more of it. For example, if you have a child who have epilepsy, these pressure pads would mainly not be sufficient to detect a seizure. So another system would be quite interesting. But it really depends how much data you want to gather and how much your approach is. Like a video camera approach gathers always a really lot of data, and you're filmed during your sleep. So I would prefer to use these only in research and diagnostic approaches, not in everyday life.
Are you a fan of Portal?
A bit. A bit.
Okay, more questions?
Maybe you could stay for next session. There are people from Microsoft who can ask about Kinect.
Yeah,
exactly.
we have some contact there. Our impression was that the German division wasn't aware at all of these decisions to kill the Kinect. So if they are from Germany, I think they will not know more. But Intel is really pushing in these 3D sensors. They also have the first laptops who have these sensors integrated. So it is not a problem for us or for my research, but everything that is just working like a black box MI, they have to throw away their data and start from the beginning because you have new input, sensor input. Sucks.
Okay, let's figure out where Microsoft stands in half an hour. No, hold on, there's a new question here. Oh, actually, it's just a repetition of someone resubmitted the question about regulations versus ability. So, more questions? In that case, it's Microsoft in half an hour. Thanks a lot, Karen.